Hello, everyone. Dr. Kimball here at CarePoint Neurosurgery. I've got an interesting case I wanted to review with you. A lot of my patients are asking me the same question, which is lumbar disc replacement right for me? It's hard for me as the surgeon to download all the things that I know about what makes things right for one person versus another, but in general, I really want my patients to understand when lumbar disc replacement is indicated versus fusion, because a lot of people come to me saying, listen, so-and-so has recommended the fusion. They say, I have to have a fusion. And it can be really disconcerting when one doctor is saying one thing and then they come somewhere else and say, no, that's not the right thing. It really can kind of set up a scenario where a patient's confused and not sure who to trust. And not trying to add confusion to it at all, but let me just walk you through these films on this patient. So this is a young 24-year-old gentleman who sustained a disc herniation. Now, the picture on the right, which is over here, is showing that disc herniation on the MRI scan. This is the L5 vertebral body. This is S1. And you can see the center of this disc is basically shot all the way out. On the left is a top-down view of the spine. This gentleman's got a very, very healthy spine with some really large muscles in his back. But here is that disc herniation. So again, this white stuff is spinal fluid. If you've watched my video on how to read an MRI scan, you'll know what I'm talking about. If you haven't, please go look at that. This is the disc right here. This right here is a central disc herniation. Most commonly when people herniate a disc, it's usually off to one side and tags one nerve. In this case, the herniation is very, very central. The other thing that I'm focusing on when I look at these films is these facet joints. I'm going to show you a little model so you can kind of understand what I'm looking at. Let me transition to that. So this is a model of the spine. This is the disc right here. These joints right here are the facet joints. That's what I was pointing at. We want to make sure that in order to be able to accept the disc into the spine, that the joints in the back have to be really healthy. And that's what we're seeing on this patient's MRI scan, that these joints look really, really good. How do I know they look really good? You're just going to have to trust me on that. I've looked at thousands and thousands of these. We also have an independent radiologist that looks at these as well and makes comments and will, validate that opinion. But really, the fact that his disc herniation is very centrally oriented and is very large, that disc could be removed from a posterior microdiscectomy approach, but it's probably not the best way to get it out. Additionally, a lot of his pain is back pain or disc related. So we're trying to tie together the imaging findings, the characteristics of his symptoms, in the setting of how the rest of his spine looks. When we replace a disc in the spine, we rely very heavily on the joints or the facet complex in the back to be very supportive, because we're taking out and we're removing some of the important stabilizing muscles in the front of the spine. We need those joints in the back to be working properly. If a patient has really, really bad or advanced degeneration of the disc, those joints may be far gone and have gone through a stage of degeneration that they really can't come back from, and that amount of degeneration might not be supported by a disc replacement. Hope this is helpful. If you have additional questions about whether or not you're a good candidate for disc replacement, I'm happy to give you a second opinion. You could share your films with me through my website, and we could set up a phone call, a Zoom meeting. I'm credentialed, medical license in multiple states. If you're here in Denver, that's very easy. You could come in for a personal visit. Look forward to chatting with you soon. I hope this has been helpful. Have a great day.